The purpose of this video is to provide field officers with the essential tactical and processing skills necessary to ethically and effectively deal with persons of a diminished capacity in a manner to provide the required professional assistance these persons need, to protect the community, to safeguard the officers involved in the encounter, and to enhance the agency's risk management.
This video is not intended to replace the CIT in-service course. On the contrary, KLCIS encourages all officers that have the opportunity to attend the CIT training. This video is intended to train officers on the KLCIS model policy and how to make a best practical response when dealing with persons of diminished capacity, excited delirium.
Every community can expect its law enforcement officers to encounter persons of diminished capacities. This group of special needs persons presents field officers with different and often complex issues. These types of persons, whether it's from intoxication, suicidal potentials, medical complications, or mental illness, present field officers and deputies with a wide range of behaviors, usually different than those exhibited by other members of the community or persons involved in criminal activities. Persons of diminished capacities may display conduct that is bizarre, irrational, unpredictable, and threatening. They may not receive or comprehend commands or other forms of communication in the manner that officers would expect. They often do not respond to authoritative persons or the display of force. It is the primary task of officers confronting these special needs persons to resolve the encounter in the safest manner. It is the task of the officer to bring these types of persons to professional resources when necessary. It is not the mission of the officer to diagnose the root cause for the person's behavior. Every officer can expect to encounter these types of special needs persons while performing their official duties. Officers are expected to control the incident. Proper tactical and intervention techniques can assist in resolving the immediate field implications of the encounter and hasten the intervention by professional resource persons. Persons of diminished capacities refers to a segment of the community officers will be expected to encounter. It encompasses all persons encountered in the field who exhibit unusual behaviors commonly referred to as irrational, bizarre, unpredictable, or weird. These outward, observable symptoms could be the result of intoxication, drug use, suicidal indications, mental illness or medical complications, intellectually and developmentally disabled, autistic, dementia, and Alzheimer's.
This policy does not require officers to make a clinical diagnosis of whether the subject is mentally ill or what form of mental illness the subject may have, but rather to use reasonable judgment to recognize behavior which is outside the norm in which a person poses a danger to themselves or others.
Mentally ill person means a person with substantial impaired capacity to use self-control, judgment, or discretion in the conduct of the person's affairs and social relations associated with maladaptive behavior or recognized emotional symptoms where impaired capacity, maladaptive behavior, or emotional symptoms can be related to psychological, physiological, or social factors.
The ultimate mission of law enforcement when encountering a person of diminished capacity is to control that encounter and then determine the best course of action for that subject person. The field tactical response can be segmented into 4 distinct tactical responses. The first being containment, the second coordination, third communication, and fourth time. Containment. Before any reasonable control and diffusing techniques can be used, the subject has to be contained. 2 officers shall be dispatched to an incident involving a person of diminished capacity. Should an officer find him or herself in a situation with such a person, the officer shall request a backup before attempting to intercede. And that's always smart. You can't have too many people at these things. We realize that many of our departments are from one-man departments or have limited backup. This shouldn't be a consideration for one of these calls. please call for help. There's got to be a sheriff's department, state police post, somebody nearby to come and back you up on this particular call. You're not responsible for the time of the response, only that you request backup. So please, again, make that request.
Come on,
Just
Chad.
leave me alone. Go
Knock
away.
this shit off. There's no aliens.
No,
Come
you
on,
can't
Chad.
help me. You can't help me.
The police are going to be coming.
Go away.
Come
They
on.
don't want you here.
You haven't been on your meds. Come on. There's no aliens.
Man,
Chad,
meds
come
are
on.
no good for anything.
Chad.
Go away. I don't want you here.
Come on. Knock
Can
this
you all
shit
move
off.
back?
Man, we got.
Gotta
go. The
quit.
police are
Gotta
coming.
get away from me.
Hey,
Chad,
I'm
come
not
on.
going anywhere.
Can you-
I'm
sir, can you
fine
move
right
back?
here.
He's officer.
I'm fine right here. What,
Hey, what's
what y'all? I don't want you here.
what's going on
Why are you
today?
here? I don't want you here.
What's going on today?
Nothing's going on. I'm all right.
You're all right?
No, yeah, I'm fine.
Why are we here today then?
I don't know, but you're not supposed to hear. They don't want you here.
Who don't want us here?
The people, they got things in my head. I don't know. It's aliens.
Aliens?
Yes.
Well, how about we get you some help?
No, they don't want me to go. They're telling me not to go right now. I'm not supposed to go anywhere.
You're not supposed to go anywhere?
No.
Okay.
No. Why are you here?
I'm here to get you some help.
I don't want you. I don't want y'all. Y'all need to leave. I'm not
Well,
going
we're
anywhere.
not going to leave. We're not going to be
No.
leaving.
No,
We want to
Okay.
get you some help.
no, you can't help me. Nobody can help me. They got things in my head. They got me bugged. I don't know. I can't do anything. I can't leave. I don't know what to do.
Are you supposed to be taking any medicines?
I hate medicines. I threw that stuff away.
Okay, so they gave you some medicines you haven't been taking?
Yeah, I don't believe in that crap. It's terrible. It makes me feel stupid.
Okay. Well, how about we try to get you some help?
No, I don't want any help. I don't need any help. I'm fine.
We got time. So come, you want,
They don't want you
What's
here.
your
I
name?
don't want you here. Why are you here?
what's your name?
It doesn't matter what my name is. Y'all can't help me.
Well, I have to know what's going
They're
on.
listening to you right now. You need to leave.
No, we're not going to leave. We're not going anywhere.
I don't need any help.
We got an ambulance coming here.
Who needs an ambulance? I'm fine.
Well, we need to get you down to talk to somebody professional
I
and
don't
get you some help.
need any help. I don't need any help. I'm scared. They're going to get me. They said
We're not going to let anybody get you.
they do things to me. They bug me.
We're here to
got things in
we're
my
here to
head.
we're here to help you and here to make sure that you stay safe.
You can't help me. Nobody can help me.
Will you give us a try?
They don't want me to. They don't want me to go.
Who's they?
The aliens, they're everywhere. They're telling me that right now that I'm not supposed to go anywhere.
Well, I don't hear anything. I don't hear any aliens.
I do. You can't help me.
Well, I can try to get you some help. We need to get you
Scared
calmed
of them.
down.
They don't want me to.
Well, we're not going to let anything happen to you.
How did you prove that? I don't know. I don't trust
Hey, we're here to keep you safe. Okay? Would you go to the ambulance with me?
Can they help me?
Yes, they can. Come on, I'll take you over there. We'll make sure you stay safe all the way there, okay?
Can they help me?
Yes, we can get you some help. These people here are going to help you, okay?
What's it going to do?
We're going to help you.
When you respond, responding officers should avoid the use of emergency lights and sirens when responding to this type of call for service. Now, that's as you get close. You may initially, depending on the type of call, if there's a weapon involved especially, have to run lights and sirens. But as you get closer, much like a bank robbery in progress, you may want to cut those down. Experience has demonstrated that this may agitate the response made by the individual on this type of call. Remember, if you're not utilizing lights and sirens, you can't drive in the emergency fashion as determined by KRS, and you have to obey those laws. Containment. When the officers arrive at the scene, they will see family members and the suspect, and then you're going to start separating the suspects from the citizens, family members, etc. Coordination. This is essential for control of the encounter, and this is the foundation for the development of an effective plan and use of personnel and resources. When two officers are responding, Always utilize contact and cover tactics. Contain the person with diminished capacity to ensure that outside persons and/or family members do not interfere. Officers should continually gather intelligence regarding the subject being encountered. This type of information can come from persons at the scene, neighbors, and/or family. Also, determine what resources should be requested, including additional police personnel, specialized weapons, and professional resources and staged medical personnel. Designate the location for a command post and staging area, and this should be out of sight of the location of the subject encounter. Communication. Communication with the person of diminished capacity should be planned and controlled. Prior to engaging the subject in communication, the initial responder, when practical, should wait for the arrival of a cover officer. When dealing with edged weapons, officers should, where possible, maintain a zone of safety which allows for reaction should the subject decide to attack. One officer shall be designated as the contact officer, and they'll be the individual directly responsible for communication with the person of diminished capacity. Other officers should assist with containment and coordination of other resources, such as medical personnel, assisting family members, setting up perimeters, etc. Verbal communication should be non-threatening. Whenever possible, use open-ended questions designed to facilitate the subject's participation. If the subject does not respond, use other communication techniques. It may be necessary to change the person designated as the command voice and determine whether that might be beneficial. Officers should use calming communicative attempts when possible. Sharp, authoritative commands should be avoided unless absolutely necessary. It's been found that threats to arrest or use force are not productive when dealing with persons with diminished capacities. Reassure the subject that the police are there to help. Be as truthful as possible within the scope of that particular situation. Officers must constantly analyze what effect, if any, their efforts are having on the subject. This is essential to identify areas that appear to agitate the subject that should be avoided. Normally, family members should not be used in an attempt to establish communication. This frequently makes the situation worse. Time. The concept of elongating the encounter rather than speeding it up. History has shown that the longer the encounter is allowed to occur, the better the chance for a successful and safe resolution. Increasing the time of the encounter and using diffusing techniques allows the subject to reflect upon his or her predicament. Creating time also allows the field units to be supported by the deployment of additional police personnel, specialized equipment, and medical support personnel. Time encourages the ability to communicate and create a relationship between the subject and the command voice.
One special circumstance that officers could encounter is excited delirium. Excited delirium is a state of extreme mental and physiological excitement, characterized by extreme agitation, hyperthermia, excessive tears, hostility, exceptional strength, and endurance without fatigue. This should be considered a true medical emergency. Possible causes of excited delirium: hypoxia, an inadequacy in the oxygen reaching the body's tissues; hyperthermia, unusually high body temperature; hypoglycemia, lower than normal level of blood glucose; drug use; stroke; intracranial bleeding; and severe mental illness. Persons suffering from excited delirium may exhibit one or more of the following: irrational speech, speaking in gibberish, shouting, yelling, or screaming; confusion; sudden changes in behavior, raging followed by sudden calmness; paranoia, belief that someone is after them; frightened, panicky; hallucinating, delusional, hearing voices; violent, destroying property; unexplained strength, endurance; high level of pain tolerance; sweating profusely; high body temperature; difficulty breathing; foaming at the mouth; drooling; dilated pupils; evidence of self-inflicted injuries; removing clothing; completely naked; resisting violently during and post-restraint; unable to follow commands or directions; gravitating towards shiny objects such as lights or mirrors; and grandiose delusions.
You want to call on the radio? You want to call on the radio?
Dispatch, we may have a case of excited delirium. Start me an additional unit.
Calm down. No, I can't do this. Come on, Mike. Mike, calm down, Mike. No, I can't do this. Calm down, Mike. Bring it up. Mike.
Step back.
Calm down, Mike.
Sir.
Come
Sir.
on, man. The police.
Sir. Go ahead and step back.
He's my brother, and he's on PCP.
Okay. Just take a step back there for me. Hey, sir. Why don't you come over here and talk to me for a minute?
No, I'm burning up.
What's going on today? Tell me what's going on. Sir, look at me. What's going on today? Sir, come over here and talk to me.
Got it, said it.
Lady. Yeah.
I'm burning up. Help.
Radio, go on and send in your score.
Stay down for me.
Stay calm. I'm gonna set you up.
Bring the leg in. Have a seat on there.
Okay.
Burning up.
The next thing we're going to talk about are procedures, and this is pretty simply summed up by the acronym CALMS, C-A-L-M-S. The C, the first C, containment. Attempt to contain the subject in a manner which protects all persons, including the officer or officers and the subject. Announcement and advise over the radio dispatch that the officer believes he or she is dealing with an excited delirium subject. Lots of backup. Even in small agencies, mutual aid should be immediately sought to enable the officers to effectively deal with this type of individual. Extra officers are recommended to deal with custody and control procedures, which are extremely difficult in this case. In situations where the subject is outside, extra officers will also be necessary for the containment perimeter. If there are specially trained crisis intervention officers or trained negotiators available, they should also be called. Medical attention. This shall be called to the scene and staged to provide immediate medical attention to the subject once the individual is controlled and it is safe to do so. Slow down. If safety of the subject, the public, or third parties is not in danger, please take your time. Remember, persons suffering from excited delirium may become more agitated by some type of triggering event. That could be anything from you being too close to them or touching. A tactical response. When feasible, pre-plan with assignments. Which officer or officers will be responsible for direct communication with the person and who may assist with coordination and control, cover, and who may be using some type of other tool, such as an electronic control device or maybe a chemical agent. If possible, use a single deployment when it comes to a taser, coupled with immediate restraint to decrease the likelihood of a drawn-out confrontation, which may further diminish the subject's respiration levels. A 4-officer approach contemplates at least one officer for each limb. That means one officer is assigned each limb. One officer for one arm, one officer for one leg on one side of the body, and just the same for the other side. And this has been proved to be a very successful way of physically controlling one of these individuals. Officers assigned to protect the head during this restraint process and speak calmly to the subject in an effort to reduce agitation should take this job very seriously and watch out for the neck. These people don't need to go to jail the vast majority of the time. They need to get to medical personnel as soon as possible. Immediately notify medical personnel should you have an individual exhibiting signs of excited delirium.
Remember, there are professional resources available to the police agency, such as mental health professionals, emergency medical facilities, and detoxification centers. Voluntary and involuntary commitments are provisions within the state in which this agency can use for the civil commitment of persons requiring professional and psychological intervention.
Commitment procedures. The primary purpose for police response to an incident involving a person of diminished capacities is to control the situation and ensure that the person receives the most appropriate form of professional resources. In determining if a commitment or voluntary referral is appropriate, an officer should evaluate information provided by professional resources, persons, and family members. It is important for the officers on the scene to determine what, if any, ongoing threat potentially the subject poses to him, himself, family, community, and officers. This threat potentially may necessitate an involuntary commitment procedure to ensure the person of diminished capacity is evaluated by a QMHP, which is a qualified mental health professional.
Restraints. Officers should document the use of restraints on persons with mental illness on the CITE crisis report and provide a copy to the Community Mental Health Center, the facility where the person is taken. The KAR, specifically 908 KAR 2090, Decriminalization of Mental Illness, states that a peace officer may use restraints only if the individual exhibits or is threatening to exhibit assaultive or self-injurious behavior. Further, that restraints may be applied in a manner consistent with the practice of each profession. That the peace officer shall document in writing the use of any restraint. The document shall include the reason for using the restraint, the type of restraint used, when the restraint was initiated and the length of time the restraint was used, or if medication was used, name of the medications, dosage, and the effect on the individual. Documentation concerning the use of restraint shall be given to the qualified mental health professional who performs the evaluation and the facility crisis stabilization unit or intermediate care facility where the individual is being held or treated. The qualified mental health professional who performs the evaluation and the facility crisis stabilization unit or intermediate care facility where the individual is being held or treated. Transportation. The KAR also has a section of transportation stating a police officer shall transport an individual pursuant to KRS Chapter 202A or 645.120 for evaluation and hold the individual until the evaluation is completed, unless the facility agrees to hold the individual. Following the evaluation, the provider shall transport the individual to a hospital if the evaluation criteria are met and so ordered by the court, or the location of the individual's choice in either the individual's home county or county where the holding originated if the evaluation criteria are not met.
No officer shall place criminal charges against a person who is mentally ill and in need of hospitalization solely for the purpose of avoiding transporting the person to an appropriate medical or psychiatric facility. This does not preclude officers from placing appropriate charges for any criminal offense based upon probable cause in accordance with the KRS. Those persons who are a danger to self or others should be taken into custody and transported without delay to a hospital designated psychiatric facility. Criminal charges, a summons, or arrest warrants can be obtained by the officer in relation to any all criminal offenses subsequent to the primary objective of appropriate medical and/or psychiatric treatment. Use of restraints when dealing with persons of diminished capacity. These types of persons may present officers with conflicting consideration in determining the best means for restraint and transportation. The ultimate mission is to safeguard the interests of the subject and the transporting officers. In some cases, an ambulance may be required. Officers shall use only those restraining devices for which they have been trained. Reporting requirements. Officers shall prepare all required reports whether the subject of the call is arrested, committed, or released. This can provide valuable information for future contacts and, when available, allows the agency to provide information to statewide data system. We would encourage you to review your agency's policy or the Kentucky League of Cities model policy on this topic annually. Thank you.
I thank you for your attention during this video, and I encourage you to take the full 40-hour course. It is Kentucky Law Enforcement Council certified, and you can find it in the Department of Criminal Justice Trainings catalog. It is offered regionally, and we encourage you to take the training within your community mental health region. Thank you.